Hello, my name's Judy Goodfellow. I'm a therapist and a researcher in the NHS in Scotland. I'm really keen to hear the views of those who care for adults with a learning disability for this study. We're interested in the impact of sensory integration therapy on people's interaction and social communication. It's a qualitative study, which means it's using conversations to gather data, and the study's been approved through the East of Scotland Research Ethics Service and Ulster University Ethics Filter Committee. I'll explain a little bit more, and I'm hoping you can help. This is the challenging part for any study, trying to gain participants, but without the participants, there's no study. In the UK, there are many therapists providing Ayres Sensory Integration therapy to adults with learning disabilities, and we really need to capture the impact of this great work in research studies. If an adult you know, either through being a therapist or a carer, has received Ayres Sensory Integration therapy in the last 5 years, then you are in a position to contribute to this study, and I'd really like to hear from you. There's a gap in the research base around providing Ayres SI therapy for adults with a learning disability and studying the impact this treatment may have on their interactions, language and social communication skills. We're interested in adults with a learning disability in the UK who've received Ayres SI therapy from a suitably qualified therapist in the last 5 years. This study's aim is to give a voice to the carers of these adults. This study consists of a single conversation with a carer over the telephone. I will be audio recording all the interviews for my analysis, which meets the ethical demands of fairness, transparency and avoiding bias in this study. I'll go back over the interviews and transcribe them. The recordings will be kept confidential and secure throughout the study and be stored thereafter in line with any other clinical trial study data. All participants will remain completely anonymous, and any reference to people will be through the use of pseudonyms, so not their real names. The definition of carers is quite wide. This could be you or someone you know, a family member, paid or unpaid carer, teaching or support staff in a college, a staff member in a residential, outreach, respite or other support service. I hope to interview between 5 and 10 carers from across the UK, and I've been fortunate to have already started with one participant employed in a further education college. If you're a therapist who's seen a number of adults with a learning disability over the last 5 years, you are my gateway to participants. Approaching the family or carers of one or two of these adults would be to ask them only for their permission for me to make contact with them. This would not commit them to the study at this point, and I would speak to them and answer any questions they may have before they make a decision about consenting to take part or not. If this has sparked your interest and you know of potential participants for this study, please consider supporting this research to broaden our understanding of the benefits of Ayres SI therapy for adults with a learning disability in the UK. My email address is judy.goodfellow@nhs.scot. I will look forward to speaking to some of you who are watching this. Thank you so much for listening. Please do get in touch.